Why are you closing hospitals?
Why is Calderdale getting everything?
What's the difference between A&E and an urgent care centre?
Shouldn't we be sorting out community health services before hospitals?
I think in healthcare we've got a number of challenges at the moment. As medical director, the key one for me is quality of care. We know that some of our outcomes are not as good as they should be, and we know we can improve on those if we develop a modern system for caring for people. So we're looking at developing a new way of delivering urgent and emergency care, both in Huddersfield and in Calderdale. We're not closing either of our hospitals. We're developing new facilities which will be modern and fit for purpose and deliver better standards of care for the future. We will have one focusing on planned care and the other on emergency care. I think for the planned care side, so these are patients who are having surgery or other procedures which are planned some time in advance. We'll have a specialist facility available to do that for them. They can be confident that the procedure will take place at the time we plan because it won't be disrupted by the need to provide emergency care for somebody else. Our emergency centre, dealing with the most critically ill patients, i.e. those which will be arriving via ambulance, will be sited at the Calderdale Royal Hospital. And I think we need to remember that your care when you're critically ill starts at the moment that you're picked up by that ambulance by specialist trained paramedics. It will deliver you to a site where we will have experienced and senior doctors ready and waiting to make the right decisions for you, backed up by a fully functioning hospital ICU service, paediatric service, to make sure that your ongoing care is as good as it can be. We will have urgent care centres on both of the main hospital sites. They'll be able to deal with, the majority of conditions that you would take yourself to A&E with. So probably more than 50% of patients who currently attend our accident and emergency centre will still be seen in their local urgent care centre. If we can take this plan forward, we will have a significant investment into healthcare in Calderdale and Huddersfield. They will provide facilities that will attract the best staff to work for us and for our patients. I believe it will deliver better outcomes for our patients as well. So, fewer deaths happening because our care is better. Our senior decision makers are there, but not just there Monday to Friday, but also on Saturday and Sunday. If you're critically ill, we will have the right doctors there available to make quick decisions to provide the right care for you. And this is not just about hospital care, it's also about caring for people in the community. It's really important that we develop those services as well so that we minimise the need to be in hospital. Our plans have been developed over a couple of years really by a number of expert doctors and nurses, both in the hospital and in primary care. They've been reviewed by a number of national experts and we think they provide the best solution for healthcare in the future for the population of Calderdale and Huddersfield. What we need at this stage is to hear your views, to tell us what you think and to give us your suggestions as to how we can improve them further. You can do that either by attending one of the public meetings or by completing an online survey or by picking up a survey which are going to be in place in a number of sites in the community, including in your general practices, libraries and other community centres.